Oh, I need lights. Hello, hello. Just wait. I forgot to shine light on the situation. There. Welcome. And happy Monday. It's Debbie. And I'm dressed in red today because we're talking about red light therapy. I thought if I set this up just right, you might have a clue as to what we're going to be talking about today. So guess what? It's Psoriasis Awareness Month. And whether you have psoriasis or know someone that is dealing with psoriasis, it is something that many of us can develop throughout the course of our life. And it's not an uncommon term. There's all kinds of things at the drugstore being sold, and there's all kinds of things being advertised online. So today I want to talk about some of the amazing tools that Lifepro has to offer that can help battle psoriasis and kind of, skin conditions in general. For those of you that have joined one of my many numerous medical rant discussions in the past, psoriasis is a symptom. Hello, Julie. Thank you for starting the trend. If you're joining my ramblings today, please tell me where you're from. And I'm going to get to some questions after I go over. There's lots of tools that Lifepro offers, but I'm going to talk about a few of my faves, specifically more so to the condition of psoriasis, because today we want to bring some awareness to that issue. It's one of those conditions that someone may be suffering with, and you may not see it because it's under their clothing, or it's in their scalp, or it's on their abdomen. So I went to Dr. Google and I did a little searching. Hello, Debbie. Great name. From Virginia. 7.5 million people in the U.S. Are dealing with psoriasis as a diagnosis. And keep in mind, when you get stats on Google, that's like it's registered, it's recorded, you've gone for the appointment. I'm sure there's many, many, many more of you dealing with this that don't necessarily have a diagnosis. And primarily, I thought this was interesting. It affects most folks with the diagnosis of psoriasis is between the age of 45 and 64. So very much still in our working and active years. Why are we getting this skin condition, and what is it? What is psoriasis? Psoriasis occurs when the skin cells are replaced more quickly than normal. So your skin is always rejuvenating, but there are some changes in that age group as well. It's not known exactly why this happens, but research suggests that it's caused by a problem with the immune system. Your body produces new skin cells at the deepest layer of your skin. Another very interesting stat, and I was aware of this before, but I didn't realize how high it was. For those of you that do have a psoriasis diagnosis, 25 to 30% of you experience joint inflammation that produces symptoms of arthritis. So if you're dealing with arthritis, 25 to 30% of you out there are probably dealing with psoriasis as well. So, sometimes, we discount symptoms, it's just, I'm not putting on enough lotion, or, it's just always been like that in my family. We live in a dry area. Don't discount these things, especially if there are other things like joint pain. These are both areas of inflammation, which I'll expand on, and why these wonderful tools are going to help you with this. How can I treat psoriasis of the skin? So we're going to talk about traditional stuff first, and what if you search on the internet, how can I treat psoriasis? Hi, Julie, and hello, Brenda. It says steroid creams and ointments, topical steroids. I'm having a tongue twister today. Are commonly used to treat mild to moderate psoriasis in most areas of the body. The treatment works by reducing inflammation. That's a really important term I want you to keep in your head today. Reduces inflammation. Okay, so that's the reason you're putting lotions and potions on your skin surface. And anytime you're putting something on your skin surface, guess what? It's being absorbed by your body. So what are you putting on your skin surface? You'd probably want to know that. So these creams slow the production of skin cells and reduce itching. Topical corticosteroids range in strength from very mild to very strong. Just like a prescription, there's going to be different active ingredients, and depending on you personally, just like an exercise plan, we're all a little bit different, and how we're going to react to these topical creams to treat our psoriasis or whatever skin conditions you may be applying them for is going to vary, A, in the strength of the cream that you're going to need to use, and B, in how effective it is for you in your personal situation. Are there any risks to topical creams? Thank you for asking that question. The risk of side effects depends on the potency of the steroid. So likely the stronger the dose, the more likely you may have an adverse effect. Depends on the location and the duration of use. If you're using some for years and years and years, maybe it's giving you something that you're trying to treat. Just my 2 cents. Many of the side effects resolve on their own after stopping medication. Common side effects are itching, burning, redness, dryness, atrophy, which is skinning of the skin surface, stretch marks in the armpits and the groin as well, easy bruising and tearing of the skin, enlarged blood vessels, often called spider veins, localized excessive hair growth, infection around the mouth, acne like rashes, purpura, purple spot colors due to skin hemorrhage, breaking the small blood vessels. You might notice little purple spots underneath the skin surface, looks like bruising. And other rare side effects include suppression of adrenal glands, which can lead long-term, get this, to diabetes, high blood pressure, fluid retention, and osteoporosis. Isn't that the reason a lot of you guys are buying these toys, is to fix these problems? Just wondering if there's a link here. Other side effects, rosacea, changes in skin color, delayed wound healing. It's going to, keep in mind this could be an autoimmune thing. Localized pustular psoriasis, which is like acne. It's big, white, pussy, full bumps that develop in extreme cases. Cushing Syndrome, a metabolic disorder caused by overproduction of I'm going to say this word right today, corticosteroid hormones by their adrenal cortex, and often involving obesity and high blood pressure. Something else many of you are probably dealing with. Growth retardation in young children, so it's going to stunt their growth. Glaucoma and cataracts. So those are some of the things that you may get if you are currently using topical creams. This is just, I'm not saying everybody's going to get them, but these are listed side potential effects of using topical steroids on your skin. Let's turn now to other ideas. Hello again, Brenda. And Julie, she has several products from Telepathy. I'm going to get to the other side here and see, if you are dealing with skin conditions. Today, primarily, we're trying to bring some awareness to psoriasis. Many of you are dealing with it, but there's a whole spectrum of skin conditions out there. And many of you might be dealing, psoriasis is a symptom. Your body is presenting something because it's in a state of inflammation. So we just talked about there's a lot of over-the-counter prescription options available to you, but there was a whole list of potential side effects, and many of them were similar to the effects you're getting with psoriasis. So I want to talk about light therapy. There's lots of different light therapy. There's so many studies out there supporting. Sometimes it's understanding what you're looking for. You're not going to go red light Visicure mask, which I left upstairs charging. I'm going to have to go grab that. You're not going to find a study on that, but you're going to find things on red light therapy, blue light therapy, photobiomodulation. There's a whole bunch of scientific terms. And what you need to know is the efficacy is there. Red light therapy has been shown 10 ways from a Sunday to improve skin conditions, including psoriasis. Of course, it's me, so I'm going to get to a couple of studies, which my girl Lauren's going to post here in a little bit. But here, I want to compare side effects. So we read the whole list of side effects. For those of you that might be joining me late, there was a big list of those when you're using topicals. Guess what the side effects of using red light therapy for psoriasis are? Zero. There are no adverse effects. If there are reasons you should not be using red light therapy due to your skin condition, that's a discussion you should be having with your doctor or your dermatologist prior to joining Debbie for a session. Okay, so you need to make sure it's suitable, but in 99% of the cases, keep in mind red lights are being used to accelerate the healing of wounds. They're healing scaly skin. They're reducing acne. So all of these things logically, even though you might have acne, not psoriasis, the symptoms are the same. So I want to hone in on a couple of things specific to red light. So you can keep using your meds to fix something. They have their place. Certainly, but if you're finding long-term things are just not improving, I suggest you consider some of these tools that you may already have at home and are using for other reasons, or if it's something that you've been considering, whether it's in a dermatology office or a commercial treatment center somewhere, you can encompass the healing benefits of a lot of the science out there in many of the home products that Lifepro is bringing to you at a fraction of the cost of some of those treatments, to be honest with you. So on to the positive page. Light therapy reduces inflammation. I said earlier, there's one thing I want you to remember that these topical creams are very good at doing if you're dealing with psoriasis. And the big point was that they reduce inflammation. Red light reduces inflammation. Yes, I did read that right. Yet, they are non-invasive and do not have side effects. Now, I think the reason we tend to lean towards the creams and the pills more than the tools is simply a discipline thing. It's easy to just slap some lotion on your face or on a spot and feel like you're treating yourself. With any of these products, whether it's red light, whether it's a treadmill, whether it's weights, consistent, regular use is going to improve your situation. You can't sit down for one day and put your Visicure face mask on and think your acne is going to be gone by morning. It took time to develop these conditions. Psoriasis develops over time. It's something that's presenting itself because your body has been inflamed for whatever reason. A lot of the reason we develop inflammation is due to medications, poor food habits. Our body is acidic and it's crying out for help. It's presenting these these conditions on the surface of our skin because that's one of the ways that our body detoxifies. So, which red light also happens to help with. So, one study that I wanted to hone in on, and Lauren has kindly posted these up for those of you that want to take a little bit of a closer look. A combination of 830 and 633 nanomes light-emitting diode phototherapy, light therapy, shows promise in treatments of recalcitrant psoriasis, which is like consistent chronic. The anti-inflammatory effects of LED energy have been well documented, as has their use in wound healing. So this is a review of several other studies. That's all you kind of need to know. It's been proven time and time again. Another study, efficacy of red versus blue light, I wanted to hone in on because some of you are, if you're using red light therapies, especially the Visicure mask, there are several light spectrum colors available on that product. And if you tend to break out on the face, blue light is very good for the inflammation of specifically the pimples. And there was an edge. This one study stated that both red and blue light therapies were very effective in treating psoriasis. So you that validates that there again. But the difference between the two wasn't significant enough for scaling or hardening. So, whether there was a group using red and a separate group using red, and they found the benefits were the same. However, the blue light therapy, when it came to treating erythema, which is like the pimply stuff, or the red skinned, erythema is what it's called, is a type of skin rash caused by injured or inflamed blood capillaries, and it is and shrinks the capillaries to reduce the pain. It can be a very painful condition. So I've had Lauren link that one in there as well. Many of you are using red light therapies, and there's never one perfect tool for every application. So I want to go over a few of my suggestions, and then I'm going to come back to some of your questions, and even maybe you've got some suggestions as to how you've been using some of these tools. So I'm just going to switch gears back here and take my visual aids so that I can read. And I put a nice little plant here to make everything look pretty today. The first thing I want to talk about is the Visicure mask. And as I said, I left it plugged in upstairs, so I'm not going to run and go grab that. But if you're dealing with skin conditions or psoriasis in general on the skin surface, I highly recommend considering the Visicure simply because it's hands-free. You can do other things. It's light, it's rechargeable. You can take it with you where you go, but it's the ideal tool if you're looking at specifically treating your face or your scalp. I find if it kind of fits like a pair of sunglasses, so you can slide it up onto the top of your head, and you can treat if you're treating for hair loss or other things. But if you have psoriasis on the face or the scalp, this is a really great tool specifically designed to work best in that area. It's very inexpensive, and it's probably for those of you that are also maybe in that 40 to 64 range. As I said, that's who it affects the most, the psoriasis. We're thinking about wrinkles, we're thinking about bags under our eyes, so it's also kind of a dual purpose on the aesthetic side. So this is great, like I say, to get that the psoriasis under wraps. Whether you want to use the red or the blue light, you've got the option of both. You've also got an amber setting on this, which is a little bit more mild. If you are dealing with severe skin conditions, that might be an option to try. There's never going to be one recipe that's perfect for every single one of you out there, because we're all different. And how these symptoms present themselves, I could line up 100 people with psoriasis, and they're all going to present different as far as how it presents itself. But if it's primarily in the face or on the scalp, this is absolutely something I consider looking at. If you do have it now, start using it for that. Consistency is the key. And if you're dealing with severe symptoms of psoriasis, I always recommend starting conservative with any of these devices until you know how you personally adapt to these technologies. So I would say 3 to 4 times a week, 10 to 15 minutes to start if it's severe, and kind of progress from there depending on your personal tolerance. The next one I want to change gears to is the Eleva Red Belt. I don't know if you have considered this one, but many of you have already gotten this as a skin tone or a back pain tool, because there's a lot of you dealing with back issues, and there's a lot of us wanting to trim and tighten. It's summer, we're in shorts, we're in bathing suits. So the Eleva Red is an infrared light belt that, ideally it works best around the waist, but you've seen me in other sessions if you've watched some of my red light series. This is a little bit more universal if you're looking to treat other areas and if you have other symptoms. So maybe you are dealing with low back pain, or you're trying to treat for, some skin tone. Maybe you've got frozen shoulder and neck pain. What I like about the Eleva Red Belt is you've got more so than the face mask. You've got more exposure, you've got more lights, you've got more area that you can treat, and it's ideal to still take with you on the go. So if you are dealing with chronic backache pain, neck and shoulder issues, you want to get that under wraps. But if you happen to also be dealing with skin conditions, you may notice those areas improving. And if it's not something you've considered using as a treatment for those areas, for me, my number one reason that I use the Eleva Red Belt is on my knee, because I have a really bad knee. So that's primarily where I'm using it, on the couch at night. But sometimes I break out on my back, or, just because I've been working out or sweating in the garden a little bit more. This is a little bit more convenient to treat my back than my face mask. So again, there's never one perfect tool for every application. But if this is one that you have, you are dealing with a bigger surface area, if you're considering red light therapy, and you're looking at using it more than a face and a head application, you might want to consider something like this. It's a little bit more universal. So I'm going to put that one back together. If I had to pick one red light tool today, and I say today because there's some surprises coming later this week, but I can't tell you too much about that yet today. I would say the best bang for your buck, long-term, for the whole family, for the most universal applications, would be the BioHeal panel. It's not the most portable option. Again, you can't have the best of everything in each product. But what I like about the panel is it's hands-free. So if you're dealing with severe conditions of psoriasis, severe pain, I don't want you having to hang on to something or apply it on that skin surface directly. I think you'll really enjoy the panel. You can set it beside you. Perhaps you're dealing with a face condition. You can put it beside you while you're sitting on the TV. You could attach it. I've got some pulleys on the wall on the back of this thing. If you've never looked closely at this product, it's got legs. So you see the little feet on it. But you can set it on the floor in front of you. It's got a little easel. Okay. So depending on what you want to treat, but I would say this is more a passive, hands-off, total body treatment. And depending on the number of areas you're looking to treat, maybe you want to put it close to you, beside you, for your face. Maybe you're dealing with spider veins or achy feet, swelling, those type of things. Psoriasis presents itself primarily, we think of that scaly skin, but it can be swelling, it can be puffiness. And as I said in the earlier stat, out of everyone dealing with psoriasis, 20 to 30% of you are dealing with joint pain as well. So it's kind of a dual treatment. You're getting the skin condition under wrap, but you're also treating the joints and the inflammation that's also present in those areas. So, if I had to pick one out of everything here to treat my aches and pains and my psoriasis, I think you'd really enjoy the panel and a product that we have coming later this week. Little bit smaller than this, but we do have another light therapy product coming later this week that is, again, hands-free and very ingenious, of course, on behalf of Lifepro's thought team, whoever that is. So again, just to sort of recap, when you're looking at red light therapy, there's a bazillion studies I could throw at you. Lauren's been kind enough to post a couple of examples today, but the efficacy is there. And sometimes when we're looking at alternative technologies, we're not looking at it for multiple issues. Maybe you're dealing with pain, or maybe you're dealing with weight, or maybe you're dealing with a lack of energy. It's usually that primary need that gets us surfing on the internet and seeking these solutions. But, I think you'll be pleasantly surprised if you're not using red light therapies now, how many other things they can treat outside of the reason you went looking for it in the first place. So for me, the no-brainer with psoriasis, it's Psoriasis Awareness Month. That's the reason for our talk today. It's hands-free. There's no nasty side effects to be worried about. There are a few tips I would consider if you're using light therapy for the first time. Common sense stuff, less is more. Please, if it's your second day owning one of these products, and I see you on the VIP page saying, how many times a day can I use it for a half an hour? Less is more. Just because a device is set to go 15 minutes or 30 minutes or a half an hour, you're looking at this today for a medical reason. You're not at a baseline of health. So don't do the baseline or the athletic level or setting. Durations and overdoing it, you can't really overdo it with red light. But I do want you to heal, and it doesn't need to necessarily take a long time. So start 10 to 15 minutes, 3 to 4 times a week. Establish, kind of how your body is reacting to it. That may very well be enough. If you're finding that you want to ramp it up a little bit, add frequency before you add more time. So if you've been doing it 3 to 4 days a week and you want to, improve or speed things up and see other effects, try doing it daily or 5 to 6 times a day. Don't just keep adding more and more and more time. If you've been using red light for a period of time and you find you're kind of plateauing and becoming stagnant, things aren't getting worse, but they're not necessarily improving, your body, just like exercise, adapts to anything if you're continuing to use it regularly. So have a little rest and reset. For those of you that have been using your red light therapies, whether it's for what we're talking about today with psoriasis and skin conditions, or weight loss and skin toning, if you've been using it regularly, same time, same setting, it's not about just going longer and longer and longer. Your body gets used to anything after a period of time. So change up your settings, change up the time of day that you're doing it, or better yet, just take a break. Take, like a week off or 3-4 days off, kind of like a rest and reset. You've heard me talk about this before, and start back at about half to 3/4 of the time that you were doing before. In many, many cases with red light therapy, your body gets used to it, and it's only really going to absorb as much as it needs. And because it knows what this is and it's getting used to it, it's adapted to the technology. That's probably a better word. You may not need as much treatment time to see the effects because your body's gotten used to it, and it knows what it's looking for when it gets this treatment. And you may notice if you're a daily user and you're using it regularly for aches and pains on top of the psoriasis, if you notice you've gotten some relief and the aches and pain thing aren't there, you can back off a little bit on the maintenance phase. And like I say, 2, 3, maybe 4 times a week. But if you are using this and you've seen improvements and things have cleared up, do not stop. Just because things have gotten better, doesn't mean that they may not resurface, because these conditions came for a reason. Our body is full of toxins, whether it's from the air, the water, the food, the chemicals we apply to our body with our aesthetics. We're all exposed to these things, and our body becomes acidic and it presents itself. The body isn't functioning as well. That's when we start developing issues. So if you're using this and you've had good success, sometimes you make other lifestyle changes. We're eating better, we're sleeping better, our hydration is better. I hope it inspires you to continue to improve. But know that if you've been using your light therapy products for some time, you likely do not need to use them with the same veracity as when you initially started it. So I hope that's some good tips. I want to switch over now, make sure I got all my tips. Oh, my favorite tip of all, of course. Prior to any of your red light treatments or during your red light treatments, add a few minutes on your vibration plate. If you use that now, or your compressions, or whatever it is that you're using, anything you can do to boost and increase circulation is just going to better prepare your body for what you're doing to it next with some of these other products. So if you've got a vibration plate as well, I always say it kind of like better prepares your body for whatever you're going to do to it next. Many clinics incorporate the use of vibration plates in combination with the red light therapy, especially if you're using it for weight loss. I would recommend, doing your vibration plate exercises during or after your red light therapy, just because it really helps expedite the process. But if you're using red light therapy for skin conditions, aches and pains, a minute or two on your machine just to get things moving and flowing, oxygenate the blood, is just going to make the effects of your red light therapies that much more optimal. So I hope that offered some insight and not too much rambling. I'm going to switch to questions. I have all of these tools. I didn't even think about using them for this. See, there you go, Brenda. Sometimes I'm just the yappy lady that plants seeds. There's so many things that red light, vibration, so many of these wonderful tools that Lifepro can use. Again, we get fixated on why we looked into it, bone density or weight loss, and we don't really sometimes realize other things until we're physically experiencing themselves. And if you're using your devices regularly, you're going to start noticing other benefits that you didn't even realize. If you're only using them once in a while when things are bad, you're not going to notice some of these other soft benefits. And I call them soft benefits or side benefits versus side effects. So Brenda, these are things to start paying attention to. And if you aren't using them regularly and you do have skin conditions, that's a really fabulous reason to get started. Brenda says she had a big breakfast, on her arms and didn't even think about using my light box. Yeah, totally. I don't know what I did. I overdid something on the weekend, and it's my shoulder, but now it's like my thumb's bugging me and my wrist and everything. And I was just playing around with a few of these when I got set up. The only thing I don't have here today is my LumaCure. The LumaCure obviously could also be used for psoriasis, but it's a very short, localized treatment. And if you're looking at treating like your whole face or something, it would take a little longer. But it's on loan at my brother-in-law's. He's got some gout and he's been using it on his big toe. So that's the only red light tool I stick in my thumb. Sure would have loved today. But I'm going to use my bio paddle later when I'm sitting upstairs having some supper. But yeah, sometimes just putting these things out in your line of sight, we forget about them and we tuck them back in the box and put them in the closet. And in the summer, sometimes you're gaining the effects. We're outside. A lot of these technologies, you get some of the light spectrums from the sun, those beneficial light spectrums. So sometimes, we feel better in that warmer weather. Our joint pain, our complexion improves for a reason. But if you're not able to get out in the sun or you're just not getting your fill, don't forget about some of these technologies. Don't wait till the fall. Julie says, I love my infrared sauna, as do I. Yes, I was very excited to promote Lifepro sauna last week, and it's a very seasonal thing here. I can't wait till it's cold and my aches and pains are inflicting me. There is one of the studies. Brenda, I want to come back to this, that you are on triamcinolone acetonide. Sounds like something that you're using in the form of a topical. And I'd really, if I had more time, be interested in Googling and seeing what some of the side effects are. But if it is for related skin disorders, certainly, I'm not saying stop your meds, certainly have that discussion with your doctor or your dermatologist, but you can use some of these therapies in conjunction with your medications. Just make sure if you are taking any medications that make you sensitive to photosensitivity applications, again, have that discussion with your doctor or your dermatologist just to make sure if they're suitable, and if there's any, again, start conservative, especially if you are on medications, but have that discussion for long-term use just to make sure that it's good to use them in combination, or perhaps you need to look at changing up your medication. Hello, Brenda. Again, hello, Julie. Hello, Debbie. If anyone has any questions for me, Debbie's posted that when using the BioHeal, is sitting next to it okay, or hold it next to the area that you want to treat? It kind of depends. I like holding it on my nightstand, or depending on what your setup is. I wouldn't want to sit there and hold it, but you could use like a TV tray or put a book or something if you did want to, if you're dealing with something in the abdomen or the chest and you want to get it a little bit closer to you. What I do is I set it on one side of me, and I treat kind of sitting here for 10-15 minutes, and then I put it on I have a little chair with a table on either side. And you could do it that way, or you could suspend it above your bed, put it at your feet. It kind of depends on the area that you're wanting to treat, but I would say, it's a little bit more powerful. It's got bigger diodes than the face mask or the belt. So, 6 to 8 inches away, if you want, is probably close enough if you're trying to deal with something severe. But if you're having it a little bit further away from you, 6 to 12 inches is completely fine. Just run it for a half hour. You kind of have to play with what works best for your configuration. And sometimes if it's further away from you, you're treating a bigger surface area and you might want to go a little bit longer. If you've got it closer to you and you're treating more of a localized area, you may be okay with just shorter sessions. But certainly, like I say, 3 to 4 times a week, be conservative if you're just starting out, and kind of, add more frequency in your sessions before adding durations, especially if you're dealing with severe conditions. But thank you for bringing that up. And again, depending on what tools you have now, the BioHeal to me is a little bit more universal as far as its applications, but a little less portable than the Eleva Red or the face mask. The face mask is ideal if you are dealing with something on the face or the scalp. The Eleva Red is a little bit more universal, although obviously it's designed to fit around the waist, the back, and the shoulders. You can use it for other areas. And if you're using it on other people or pets, I find with my little kids in some of my pediatric groups, they like using red light therapy as well, but the kids don't love the mask. They'd rather sit by the panel and wear the cool sunglasses because they think that. So it kind of depends on who else in the home that you're using it for. And the panel, is a nice passive way. Maybe both of you are sitting on the couch and you're just putting it on the coffee table in front of you. Make sure you wear the safety goggles with any of those. The Visicure, that is not an issue, but if you're using the panel, the Eleva Red Belt, or the Lumicure, make sure that you're using the safety goggles that are provided, or, don't be looking at the lights. It's a common sense thing. Don't look at the lights. Are there any other questions I have out there? I have a new session coming. I believe it's Thursday this week. We have a red light new therapy coming. So stay tuned for that. I hope you've enjoyed some of the information today. Much of this you guys already know. I just make it a little bit more sciencey and, kind of kick you in the butt as far as, I forgot that I could use it for this, or I didn't think about using it for that. So combine your therapies for optimal effects with whatever you have from Lifepro. They've got such an amazing suite of products. Lifetime warranty. There's lots of products out there that are similar, certainly in their claims, but remember, you've got a lifetime warranty. You've got a group of people dedicated to seeing you succeed with their products. Make sure you know what you're dealing with. And I think Lifepro is just such an amazing company, not outside of the fact of their lifetime warranty, but they're very innovative and they're very responsive to what you guys as consumers want. So we invite your feedback. Thank you for joining me today. Don't work too hard on a Monday. And I look forward to seeing you a little bit later on this week for another live product launch. Have a great week. Don't work too hard. And I'll see you very soon.